Finally. You got to. Long time. Good to see you too. Good to see you. Really? Você já foi? Muito. Amelala. Good to see you. Hi. Hi. How are you? Oh, hello. How are you doing?
Careful planning at this point is paramount to make sure that the vaccines get to the people who are most at risk and who need it most, including those people who are living with HIV. Our hope is that this is the first shipment of more to come, and CDC pledges our support to continue to stand with the Ministry of Health as they prevent, detect, and respond to all infectious disease threats, including MPOX.
MPOX is zoonotic, and there's a reminder that human health is tied to animals and the environment. And a request and an urge to all of us to adopt the One Health approach. And that calls for a close collaboration between the veterinary department, environmental health department, and the health sectors to prevent future threats. AMREF Health Africa during this time starts with the Ministry of Health and with Kenyans in building systems that protect lives and respond to outbreaks swiftly and effectively.
We remain focused to support Kenya, the government of Kenya, in reducing the transmission and eventually eliminating MPOX from the country. In addition to vaccination, Madam PS, the Africa CDC remains deeply committed to strengthening surveillance, diagnostics, case management systems in Kenya across all your regions. We understand that responding to public health threats requires more than just vaccines. That is why we are working with you as the Ministry of Health to enhance lab capacities, expand surveillance networks, and provide ongoing training of your healthcare professionals to strengthen their knowledge and indeed improve the care of those who are affected.
We are very proud to see that today these 10,700 doses are finally reaching Kenya. It's a first delivery, but it's a first moment that adds one more weapon to our collective fight against this disease. We were taken just after COVID, we were just rebreathing where MPOX hit the continent. And so it is very important and heartening to see how countries have reacted fast. From our side, we stand close to the Ministry of Health. With all the partners, we hope to ship many more of this to the country and to continue accompanying this effort and raising awareness amongst the population so that the vaccines are well received and used as one more protective measure for all of us. Thank you so much.
These vaccines have been secured through collaboration between the government of Kenya and our key partners. We have the World Health Organization, we have UNICEF, we have Gavi, we have Vaccine Alliance, Africa CDC, American CDC, and everybody else, because Kenya is not an alien and is not an isolated country. We are going through the challenges of the world, which each and every other country is going through. It's only the degree and the magnitude of the issues, and especially on public health events that seem to have invaded our spaces.
With this allocation, Kenya joins other countries such as Democratic Republic of Congo and Rwanda that have already started MPOX vaccinations. And we recognize that the work does not stop here. Strong vaccination and successfully doing it requires strong community awareness, adequate resources, and a coordinated response from all the stakeholders. So we call upon all our partners, healthcare workers, and the community to join hands in ensuring that these vaccines will reach those who need them the most. Vaccination is one of the most important tools in disease prevention and control, but it must be part of a broader strategy. MPOX vaccine should be part of a comprehensive MPOX response. Our approach to tackling MPOX goes beyond vaccines. It includes a number of things, including testing and diagnosis, effective clinical care, contact tracing, infection prevention, and meaningful engagement with the affected communities.
The decision to introduce the MPOX vaccine was informed by the worrying rise of MPOX cases over the last few months. As of today, the number of cases has doubled from 32 reported in December 2024 to 68 confirmed cases across the country. And these cases have been reported in 13 counties. We have Busia, where we have 22. Remember Busia County, that is where we have the port of entry of Busia border, Malaba. And we have Mombasa, where we have 12. Nakuru has 10, Makueni has 6, Bungoma has 3, Nairobi has 3, Kajiado has 2, Taita Taveta has 2, Kericho has 2, Kilifi has 2, Kiambu, Uasin Gishu, and Migori have 1 respectively. Of these, 49 patients have been treated and recovered, 10 are currently admitted, and 7 are under home-based care. Unfortunately, we have recorded 1 death. Vaccination remains one of the most effective public health interventions, saving millions of lives globally every year. And this vaccine we are receiving today has shown efficacy of up to 82% in reducing disease severity, transmission, and mortality, particularly among the vulnerable population. It is our role and responsibility to ensure that there is fair distribution of the vaccines so that they reach the most vulnerable communities and individuals in the society. And the Ministry of Health will begin rolling out this vaccine in the coming months, prioritizing high-risk groups in 13 counties currently reporting confirmed MPOX cases. And these high-risk groups include individuals who have had close contact with confirmed MPOX cases, population at increased risk of exposure, especially the long-distance truck drivers, commercial sex workers, hoteliers, and any other groups that may be at risk to come into contact with individuals who have confirmed cases.